I'm Dr. Nicholas Fong from the Department of Ophthalmology in Hong Kong U.
I'm Dr. Rachel Chung from Department of Ophthalmology at Grantham Hospital.
And today we'd like to talk about the virtual reality simulator. As we all know, traditionally, we learn to use the direct ophthalmoscope with real-life patients. Not only is that uncomfortable for patients, but they also require a prolonged contact. With the advent of the virtual reality system, we hope to reduce discomfort to patients while maintaining a good teaching environment.
There are many benefits of using the virtual reality direct ophthalmoscope. One of them being the direct feedback you can get from trainers. Whilst the student is examining the patient, the trainer can give them guidance and tips on what they've found and what they can do to find things that they've missed. And at the end of the examination, they can also receive a very comprehensive evaluation of their performance as well as a combined score. Other benefits, the patient being a virtual patient and its reduced amount of strain that is usually inflicted on a normal patient with a very high intense light. We hope you enjoy learning with the virtual reality direct ophthalmoscope.
So when we approach the machine, there are a few parts that you need to notice. One is the power up button here, and this here is to control the table up and down. So when we turn on the machine, you'll see a screen that loads up like this. And this is where you enter your username and password given to you previously. So you can go ahead and do that now. So once you've entered your password, you'll see a screen like this. And there are several different courses that you have to be aware of. First, there is the device handling and the anatomy, and these are both learning modes. And finally, we will also open up the exam mode for you to test your skills. You'll see on the left side, there's a few different categories, including findings, which is something that you've been using before. You'll find that your previous history is logged in here, such as the cup-disc ratio, and when you click on it, it'll give you a little instruction as well as associated cases here. Here's your profile in which you can change your password if you need. So once you are ready, you can choose your cases from device handling to anatomy and pathology. So once you're ready to start, you'll find yourself on the course screen. And previously mentioned, there are several categories here, including device handling, anatomy, and testing exam mode. So for example, when you choose a case, you'll see that your progress is listed on the right, and your case is ready to start here. So after you click Start Case, you'll find the objectives on the top left, the patient information on the top right, and the disorder, if any, on the bottom left. Since this is a practice course, there are only objectives, including finding the arrow, square, and trident object. Once you're completed, you can quit here and move on to the next mode. So for example, if you're in the learning mode where there are pathologies, you can start the case again. And you'll notice the difference is that the patient will have a disorder listed on the bottom left, and again, your objectives of your exam on the top left. So once you've completed this, we can also press quit. So once we have the objective set, we can change it to live view. And Rachel, why don't you go over the use of the direct ophthalmoscope?
Sure, thank you, Dr. Fong. The digital ophthalmoscope is very similar to the real direct ophthalmoscope that we use in clinics. We start by turning the direct ophthalmoscope on using this wheel here, which also adjusts the brightness, which you will later be able to see on the screen. The focusing wheel at the side adjusts the focus. The main difference between the digital ophthalmoscope and the real direct ophthalmoscope is the front of the direct ophthalmoscope. To adjust aperture size, it can be selected on the panel on the screen. There are also light filters, for example, the red-free light, which is better for visualizing blood vessels on the retina.
So once you're ready to start, you go to the live view and we can begin. So Rachel, can you find the red reflex for me?
Sure. So I'll examine for the red reflex by starting from a distance. Now I've found the red reflex, and I'll gradually approach the patient.
And as you can see, the view that we can see within the ophthalmoscope is directly viewed on the monitor as well, allowing the trainer to view what the students can see. And you can also notice that the patient, the virtual simulated patient, reacts to the light, the intensity, as well as the direction of your ophthalmoscope.
May I please dilate his eyes?
So as we can see, the pupil reacts to the light. And in order to facilitate viewing an undilated pupil, we would recommend a small aperture as seen here. However, to make the examination easier, we can dilate the pupil by pressing this button here. So as we can see, once we dilated the pupil, we can also increase the aperture, which allowed Rachel to find the optic disc much easier. And once the optic disc has been located, the computer will highlight your findings as well as narrate the findings to you. Now we can see that Rachel is looking around the eye. On the bottom left corner here, you can see that this is the right eye of the patient, and here we'll see the part of the retina that Rachel can view. On the left here, the examined area is shown where Rachel has previously seen. We also recommend turning off the overlay information to make it a more realistic experience by doing so. Once you've completed your examination, you can press quit here. Yes. And we'll be taken to a grading screen. So it looks straight from the top. You can tell that you've passed with an 81% score. How they score your grade is by light exposure. So the longer you expose the patient or the brighter you use your ophthalmoscope, the lower your score. However, your exposure was very good. And for the retinal structures, the objective was to find the optic disc in this case, and you have done so here. And so for that, you've also obtained a full score. However, the examined retina, which was seen in the map here, shows that most of the periphery was not located or not observed in both eyes. And in that case, the score is slightly lower. However, it does give you a total score in which you have scored very well. And as mentioned before, once you dilate the pupil, there is a dilation penalty of 30 points. So once we get to the bottom with a combined score here, you'll see that the computer has given you a pass. And in order to give you a more realistic experience, you can press the original fundus image here, and this shows what you were actually looking at. And this is an image of the real patient's fundus. So for this part, Rachel and I would like to offer you some tips and tricks to facilitate your examination of the patient's fundus through not only the virtual scope, but also applying this technique to the actual direct ophthalmoscope. So Rachel, can you demonstrate?
So now I'll try to find the optic disc first.
So the first thing to make it easier is to control the light that you apply into the fundus. For example, if Rachel were to use a much brighter lumen, then the patient will blink more and cause a lot more discomfort. Secondly, we can increase the aperture and dilate the pupils.
I can also stabilize myself by putting my hand on the patient's head.
Another point to take note is the proximity of Rachel and the ophthalmoscope to the patient's eye. If you are too far away, then you'll notice that field of view is actually much smaller. In order to see the periphery, you have to be very close to the patient and be very steady.
I'm now tracing the vessels to look for different pathologies. And I'll follow the arcades. This is the inferior arcade. And I'll need to look up to look at the superior arcade.
So as we can see, Rachel is positioning her head as well as the ophthalmoscope in relation to the patient's eye and head. And that is the key to seeing the periphery. Secondly, the trainer can help Rachel by adjusting the patient's direction of view. For example, if Rachel is looking at the patient's superior or the left lateral part of the retina, we can move the patient's eye to the left. And again. And for more periphery lesions, we can move the patient left even further, up to a degree of 3 grades.
After completing the training, you should now be a lot more proficient in using the direct ophthalmoscope.
We hope these videos have helped you, and now it's time to use the simulator and enjoy and have some fun.